Hi, everybody. I'm Norm Thurston. I'm the Executive Director of the National Association of Health Data Organizations, or NAHDO. NAHDO is a national nonprofit membership and educational association dedicated to improving healthcare data collection and use. We've been involved in hospital data since 1986, and I'm excited today to introduce you to our Hospital Data 101. This is an opportunity for you to learn the basics about state hospital data programs. This session will include 4 modules that will introduce you to those programs, the nature of hospital data, how the data is submitted and processed, and most importantly, how the data is used to create value. Thank you for joining us today.
Welcome to Module 1, the landscape of state hospital data programs in the United States. State-based hospital data programs are essential components of the healthcare infrastructure in the United States. They serve as vital sources of information for policymakers, researchers, healthcare providers, and the public, offering insights into healthcare utilization, costs, quality, and outcomes. This module is intended to provide a high-level overview of these programs, allowing an analyst or program team member to understand their purpose, structure, and value. While the specific structure and scope of these programs varies from state to state, they share the common purpose of collecting and analyzing healthcare data. California's Department of Healthcare Access and Information, for instance, has a long-standing and highly regarded program that collects detailed data from hospitals across the state. Similarly, Florida's Agency for Healthcare Administration maintains a comprehensive database of hospital information used extensively for healthcare planning and regulation. These programs serve a multitude of purposes, all aimed at improving healthcare delivery and outcomes. Primarily, they seek to capture population-level information about healthcare utilization, costs, and quality. By aggregating data from various hospitals, these programs can identify trends, disparities, and areas for improvement in healthcare delivery. For example, data on hospital readmission rates can reveal areas where care coordination needs to be strengthened, while data on surgical complications can highlight opportunities for quality improvement initiatives. Furthermore, state hospital data programs contribute to public health surveillance by tracking infectious diseases, monitoring outbreaks, and identifying public health trends, such as hospitalization rates for chronic diseases and injury. Many state public health programs, including asthma, injury prevention, and environmental public health tracking, rely heavily on state hospital data for understanding trends. These programs also use the data to look at measures of preventable hospitalizations that should be addressed with quality primary care. Because there is value in having a national perspective on healthcare trends, almost all state programs are actively engaged in the Healthcare Cost and Utilization Project, commonly referred to as HCUP. This program is sponsored by the Agency for Healthcare Research and Quality and has been in existence since 1988. It includes the largest collection of longitudinal hospital care data in the United States. Using data submitted by state programs, called partners, HCUP produces several products including state and nationwide databases, software and online tools, and reports, allowing researchers and policymakers to compare healthcare trends across states or at the national level and identify best practices. The organizational structure of state hospital data programs varies, but they are typically operated by a state health agency or a designated data collection entity. In some states, like Indiana, Iowa, and Kansas, the authority and responsibility for collecting the data lies with the statewide hospital association, while in others, like Kentucky, Louisiana, and Maine, it is the role of a state agency to oversee the state's hospital data program. Each program has dedicated staff who manage data collection, processing, analysis, and dissemination. The legal authority for collecting hospital data stems from state statute or rules that mandate data submission by healthcare facilities. These regulations often specify the types of data to be collected, reporting requirements, and penalties for noncompliance. HIPAA, a federal law primarily focused on protecting patient privacy and data access, provides a specific exception that permits the collection of protected health information for public health purposes, including state hospital data programs. This exception allows states to collect and analyze PHI for purposes such as tracking disease outbreaks, monitoring healthcare quality, and conducting public health surveillance. Achieving 100% compliance with data submission requirements can be challenging. limited resources, variations in hospital data systems, and occasional resistance from healthcare facilities can hinder complete data collection. To address these challenges, state programs employ various strategies to encourage compliance, including outreach and education, providing clear guidance and technical assistance to hospitals on data reporting requirements, data quality audits, conducting audits to ensure the accuracy and completeness of submitted data, enforcement mechanisms, utilizing legal authority to enforce compliance when necessary, which may involve fines or other penalties. The scope of data suppliers for state hospital data programs is largely determined by state regulations and licensure requirements. Acute care hospitals, including their emergency rooms, are primary data suppliers. Freestanding emergency departments, which have become increasingly prevalent in recent years, are also sometimes included in data collection efforts. Additionally, many states require ambulatory surgery facilities to submit data, providing valuable insights into outpatient surgical procedures. However, certain types of hospitals might be exempt from mandatory data submission or may not routinely submit data. VA hospitals, operated by the federal government, often have their own data reporting systems and may not be fully integrated into state programs. This can create challenges for researchers and policymakers seeking a complete picture of healthcare utilization in a given state. Charity hospitals, depending on their legal status and funding mechanisms, might also be excluded from data collection efforts. Similarly, mental health or specialty hospitals may have specialized data reporting requirements that differ from those of general acute care hospitals. State hospital data programs collect a wide range of data elements, providing a comprehensive view of hospital activity. These elements typically include patient demographics, like age, gender, race, ethnicity, and zip code, diagnosis codes capturing the patient's medical conditions, procedure codes describing the medical procedures performed, length of stay, admission and discharge dates, and the number of days the patient was hospitalized. Billing information, such as total charges, revenue codes, and condition and occurrence codes that impact billing. Discharge status, including whether the patient was discharged home, to another facility, or died in the hospital. Information about who provided the care and where, and the payer's name, type, and the patient's relationship to the insured person or subscriber. This rich dataset serves a variety of purposes, such as tracking healthcare utilization trends, monitoring costs, evaluating quality, informing policy, and supporting research. Tracking healthcare utilization trends. Analyzing hospital admission rates, emergency department visits, and surgical procedures to identify patterns and changes in the trends for healthcare demand can help policymakers anticipate future healthcare needs and allocate resources accordingly. Monitoring costs. Examining hospital charges, case mix, and resource utilization to assess the financial burden of healthcare and identify cost drivers can inform efforts to control healthcare costs and improve efficiency. Evaluating quality. Assessing hospital performance on quality measures, such as readmission rates, mortality rates, and patient safety indicators, to identify areas for improvement can inspire hospital-driven process improvements and empower consumers to make informed healthcare choices. Informing policy. Providing data-driven insights to decision-makers can inform effective healthcare policies, regulations, and payment models. For example, data on hospital readmissions can inform policies aimed at reducing avoidable hospitalizations. Supporting research. Enabling researchers to conduct studies on healthcare delivery, outcomes, and disparities contributes to evidence-based practice. State hospital data has been instrumental in research on topics such as patient safety, health equity, and the effectiveness of different treatments. State hospital data programs face several challenges in the ever-evolving healthcare landscape. Data standardization. Standardizing data submission to ensure consistent definitions and formats across different hospitals and data systems remains a challenge. The adoption of standardized data elements and interoperable health information exchanges can facilitate data sharing and analysis. Data security and privacy. Protecting patient confidentiality while facilitating data sharing and analysis requires robust security measures and adherence to privacy regulations. State programs must implement strong data encryption, access controls, and de-identification techniques to safeguard patient data. Evolving healthcare models. The rise of telehealth, accountable care organizations, ACOs, and other innovative models requires adapting data collection and analysis approaches to capture these new trends. State programs may need to develop new data elements and reporting mechanisms to reflect the changing nature of healthcare delivery. Resource constraints. Maintaining and enhancing state hospital data programs requires adequate funding and staffing, which can be challenging in times of budgetary constraints. Advocating for continued investment in these programs is crucial to ensure their long-term sustainability. Looking ahead, state hospital data programs are poised to play an even greater role in healthcare improvement. Advances in data analytics, machine learning, and artificial intelligence offer new opportunities for extracting insights from vast datasets and generating actionable knowledge. By embracing these technologies and collaborating effectively with stakeholders, state hospital data programs can continue to drive progress in healthcare quality, affordability, and accessibility. For example, predictive analytics can be used to identify patients at high risk of readmission, enabling targeted interventions to prevent avoidable hospitalizations. In conclusion, state hospital data programs are indispensable tools for understanding and improving healthcare delivery. By collecting, analyzing, and disseminating valuable data, these programs empower policymakers, researchers, healthcare providers, and the public to make informed decisions that promote better health outcomes for all.
Hi, I'm Anthony Tapney. I serve as an Assistant Branch Chief at the California Department of Healthcare Access and Information, or HCI. I've worked with the state's hospital discharge data for over 11 years, before we were HCI and we were known as OSHPD. We rely on hospital discharge data to improve healthcare access, quality, and equity for all Californians. These data help us track public health trends, identify gaps in care, and support hospitals in delivering better patient outcomes. From monitoring injury rates to evaluating healthcare affordability, hospital data empower policymakers, researchers, and communities to make informed decisions. By ensuring transparency and accountability, we can build a stronger, more responsive healthcare system that meets the needs for every resident, because ultimately, better data leads to better care.
Welcome to Module 2, Deciphering the Nature of Hospital Data. Hospital discharge data, HDD, provides a critical foundation for understanding healthcare utilization, costs, and outcomes. However, effectively utilizing this data requires a deep understanding of its origins, structure, and limitations. This module delves into the intricacies of HDD, exploring its source, extraction process, key data elements, potential strengths and weaknesses, and how it compares to other common data programs. The lifeblood of HDD flows from hospital administrative databases. These databases are primarily designed for operational purposes, such as billing, patient management, and regulatory reporting. They capture a wealth of information generated during a patient's encounter with the healthcare system, from basic demographic details to complex clinical information. While these administrative systems vary across hospitals, they share commonalities based on industry standards. These standards ensure some degree of uniformity in data capture and reporting. Relevant key standards include UB04 or CMS 1450, the uniform billing form used by hospitals to submit claims for reimbursement to payers; CMS 1500, the form used by emergency departments and ambulatory surgical centers to submit claims for reimbursement to payers; ICD-10-CM, the International Classification of Diseases, 10th revision, clinical modification, used to code diagnoses; CPT, current procedural terminology, used to code medical procedures. These standardized codes and formats facilitate data aggregation and analysis across different hospitals and healthcare systems. Extracting data from hospital administrative systems for secondary purposes like research and public health reporting involves a process to extract, transform, and load data from one system to another, referred to as ETL. This process typically involves identifying and extracting relevant data elements from the source system, cleaning, standardizing, and transforming the data into a format suitable for analysis, loading the transformed data into a target database or data warehouse. The sophistication of the ETL process varies significantly across hospitals. Some institutions have dedicated data teams and sophisticated ETL tools, while others rely on manual processes or less sophisticated software. The quality and reliability of HDD can be influenced by the robustness of the ETL process in addition to the quality of the underlying data. Ideally, HDD should be captured at the visit level, mirroring the concept of a discharge abstract. This means that each record in the dataset should represent a single patient encounter or hospitalization. However, variations in ETL processes can sometimes result in aggregated data, where multiple encounters or services are collapsed into a single record. HDD encompasses a wide range of data elements, providing a comprehensive view of a patient's hospital stay. These elements can be broadly categorized as admission characteristics, like the date and time of admission, the admitting physician, the source of admission, like the emergency department or a transfer from another facility, and admitting diagnosis. Discharge characteristics, such as the date and time of discharge, the discharge status, meaning where the patient was discharged to. For example, home or a rehabilitation facility, and discharge diagnoses. Detailed information about the patient's treatment during the hospitalization. All diagnoses documented during the stay, including the principal diagnosis, which is the condition primarily responsible for the hospitalization, and all secondary and supporting diagnoses, and all procedures performed during the stay, coded using CPT or other relevant coding systems. Information about the patient's demographics, including age, gender, race, ethnicity, zip code of residence, and information about the providers involved in the patient's care. Data related to the financial aspects of the hospitalization, including the total charges billed for the patient's care and information about the patient's insurance coverage, often represented by a payer identifier. HDD offers several strengths as a data source for healthcare research and analysis. Population-level insights. HDD captures a large proportion of hospitalizations within a given geographic area, providing valuable insights into population-level healthcare utilization patterns. Treatment detail. The inclusion of detailed diagnostic and procedural information allows for in-depth analysis of clinical conditions, treatments, and outcomes. Race and ethnicity data. HDD often contains relatively high rates of reported race and ethnicity data, which is crucial for studying health disparities, subject to the limitations of self-reporting. Linkage potential. In some cases, HDD can be linked to other data sources, such as vital records or cancer registries, to enhance research capabilities. Analyzing HDD effectively requires understanding its underlying structure. Some HDD datasets may have a hierarchical structure, with a header record containing patient-level information and multiple line-level records detailing specific services or procedures received during a single visit. Understanding this structure is crucial for accurate data interpretation. For accurate analysis of healthcare utilization, it is also essential to distinguish between multiple visits by the same patient and multiple services provided during a single encounter. This often requires careful examination of dates, times, and service codes. Records often include several diagnosis codes. The principal diagnosis, which represents the condition primarily responsible for the hospitalization, is a key data element for many analyses. It is crucial to understand how the principal diagnosis is determined and coded. HDD is one of several data sources used in healthcare research and analysis. Other common data programs include all payer claims databases. APCDs compile healthcare claims data from various payers, including commercial insurers, Medicare, and Medicaid. While they do not include all patients found in HDD, when available, they offer a comprehensive view of healthcare utilization across different payer types and can augment the understanding in HDDs by providing a more complete view of episodes of care. Electronic health records. EHRs contain detailed clinical information about individual patients, including lab results, medication lists, and physician notes. However, accessing and analyzing EHR data can be challenging due to privacy concerns and data standardization issues. Patient registries collect data on specific patient populations, such as those with cancer or diabetes. They provide valuable insights into disease progression, treatment patterns, and outcomes. Vital records programs are the official record keepers of life events, including births and deaths. Analyzing vital records data can reveal insights into causes of death, health disparities, and the effectiveness of public health initiatives. Each data source has its own strengths and limitations. HDD, with its focus on hospital-based care and detailed clinical coding, complements other data sources and contributes to a more holistic understanding of hospital-based care. For example, HDDs can produce population estimates of hospital admissions or emergency visits by condition and produce quality measures such as readmissions for a state, geographic region, or for particular hospitals or providers. By understanding the nuances of HDD, researchers and analysts can unlock its full potential for generating valuable insights into healthcare delivery, costs, and outcomes. This knowledge enables data-driven decision-making that can ultimately lead to improved healthcare quality and access for all.
Hi, I'm Stephen Ranzoni. I'm the Program Manager for the Hospital Reporting Program at the Oregon Health Authority. Hospital discharge data is an important part of what we do at the Oregon Health Authority. We use this data to look at hospital utilization, to look at access to care, to monitor quality and outcomes, and to perform public health surveillance. It's data that's used by researchers, by policymakers, by hospital leaders to take numbers and turn it into better policy that will drive better patient care. It's also a source of transparent information for the public so that they can better understand the hospitals that make up their communities. Hospital discharge data may seem challenging at first. It may appear overwhelming. But if you take the time to understand it and to learn how to use it, it can be a powerful and impactful tool for your organization to really improve the health in your community.
Welcome to Module 3, Ensuring Data Integrity, Submission, Validation, and Remediation in State Hospital Data Programs. State hospital data programs rely on accurate and complete data to fulfill their mission of informing healthcare policy, research, and quality improvement. This module explores the critical processes of data submission, validation, and remediation, highlighting the mechanisms that ensure data integrity and the challenges encountered in maintaining high data quality standards. In today's digital age, the vast majority of state hospital data programs utilize online portals or other digital formats for data submission. These portals provide a secure and efficient mechanism for hospitals to transmit large volumes of data to the state agency responsible for data collection. To ensure accurate and consistent data submission, each state hospital data program publishes and maintains a comprehensive data submission guide. This guide serves as a crucial resource for hospitals, outlining specific requirements for data formatting, validation rules, and submission procedures. By adhering to the guidelines outlined in the Data Submission Guide, hospitals can contribute to the overall integrity and reliability of the state's healthcare data repository. Typically, hospitals extract data from their administrative systems, format it according to the state specifications, and upload it to a secure data upload portal. Some states may provide software tools or templates to assist hospitals in preparing their data submissions. The use of digital format streamlines data collection, reduces manual errors, and facilitates timely data processing. However, the transition to digital data submission can be challenging for some hospitals, particularly those with limited IT resources or expertise. State agencies often provide technical assistance and training to support hospitals in navigating the data submission process. Data validation is a critical step in ensuring the accuracy and completeness of submitted data. It involves a series of checks performed on the data to identify errors, inconsistencies, and missing values. These checks are typically automated and built into the data submission portal or processing system. Data validation rules can be categorized into several types. Format validation determines whether the data is in the correct format, such as dates, numeric values, and text fields. Completeness checks identify missing data elements that are required for analysis and reporting. Code validity checks ensure that codes used for diagnoses, procedures, and other variables are valid and consistent with established coding systems. Range checks verify that data values fall within acceptable ranges. For example, a patient's age should be a positive number. Consistency checks examine relationships between different data elements to ensure consistency. For instance, the discharge date should be later than the admission date. Data validation rules are essential for maintaining data quality and preventing erroneous data from entering the system. They serve as a gatekeeping mechanism, ensuring that only accurate and complete data is used for analysis and reporting. State hospital data programs employ a multi-layered approach to data quality and integrity checks. These checks are performed at various stages of the data processing pipeline. Initial validation is performed upon data submission to identify basic errors and inconsistencies. In-depth analysis includes more comprehensive checks conducted after data is loaded into the program's database, may involve statistical analysis, data visualization, and expert review to identify outliers, anomalies, and potential data quality issues. Ongoing monitoring of data quality metrics to identify trends and potential problems may involve tracking data completeness, timeliness, and consistency over time. Referential integrity checks ensure that relationships between different data elements within a record, or across different records, are valid and consistent. For example, if a record indicates a patient was discharged to a specific rehabilitation facility, a referential integrity check would verify that this facility actually exists within a master list of healthcare providers. These checks prevent inconsistencies and improve the reliability of the data for analysis and reporting. Organizations responsible for state hospital data programs have well-defined processes for evaluating data quality and identifying errors and inconsistencies. These processes may involve data quality reports are generated to summarize data quality metrics and highlight potential issues. Data quality audits assess the compliance of hospital data submissions with reporting requirements and data quality standards. Collaboration with hospitals to identify and resolve data quality issues may involve providing feedback, training, and technical assistance. When a data file fails a validation check, a remediation process is initiated to address the identified errors. This process typically involves notification, data correction, technical assistance, and follow-up. A hospital is notified of validation errors and provided with detailed information about the issues identified, and is responsible for correcting the errors and resubmitting the data. The program may provide technical assistance to the hospital in identifying and correcting the errors, and will follow up with the hospital to ensure that the errors are corrected and the data is resubmitted. The remediation process is crucial for ensuring that data errors are identified and corrected promptly. It helps to maintain the integrity of the HDD and ensures that accurate information is used for analysis and reporting. Recognizing that not all hospitals have the same level of sophistication in data management and reporting, state hospital data programs may provide exceptions or exemptions for certain facilities. This may involve relaxed requirements, often called exceptions, exemptions from submitting data, and technical assistance. Hospitals with limited resources or technical capabilities may be granted an exception to submit data in a less granular format or with less frequent reporting. Exemptions from certain reporting requirements may be granted to small hospitals or those with unique characteristics, typically determined by a formal request and review process. Technical assistance and training may be provided to hospitals that need support in meeting data reporting requirements. These exceptions and exemptions are intended to ensure that all hospitals can participate in the state's data collection efforts, regardless of their size or technical capabilities. However, it is important to balance flexibility with the need to maintain data quality and comparability across hospitals. As technology continues to evolve, state hospital data programs may consider new approaches to data submission and processing. This may involve utilizing APIs and other technologies to automate data extraction from hospital systems, reducing manual effort and improving data accuracy. Moving towards real-time data submission, enabling more timely analysis and reporting of healthcare trends. Leveraging cloud-based platforms to enhance data storage, processing, and analysis capabilities. And employing machine learning and artificial intelligence to identify patterns, anomalies, and insights in hospital data. By embracing innovation and continuously improving data submission and processing procedures, state hospital data programs can ensure the availability of high-quality data to inform healthcare decision-making and drive improvements in patient care.
Hi, I'm Jennifer Howley with the New Hampshire Division of Public Health Services, and I'm a data scientist working primarily with our hospital discharge dataset. This dataset includes all people utilizing the hospitals, not just the insured. Therefore, it gives us an understanding of the health needs of our entire population. We use the data to get counts and rates of all hospitalizations and emergency department visits for many health outcomes of concern. We can look at these rates across time or across counties or communities. It gives us valuable insight to where resources and interventions are most needed. Our hospitals also use the data to better understand where service needs are being met and where there are unmet needs. We can find what communities are traveling long distances for specific services and help answer how those needs can be met in their own communities. The hospital discharge dataset does have its own unique limitations that you must be aware of when working with it. But once you know these limitations and know the advantages, there are many questions that can be answered with this valuable dataset.
This is module number 4, Unlocking the Potential of Hospital Data, Applications, Limitations, and Access. Hospital discharge data offers a wealth of information for understanding and improving healthcare systems. To truly use this data effectively, we need to understand both its strengths and its limitations. This module explores the diverse uses of HDD, highlighting its benefits and drawbacks, showcasing real-world applications, and outlining the steps involved in accessing this valuable resource. Hospital discharge data is an essential tool for analyzing healthcare trends and improving patient outcomes. It provides insights that support various public health and policy efforts. For example, hospital discharge data can provide population-level insights. One of the main benefits of HDD is that it provides insights into healthcare utilization, costs, and outcomes across entire populations. HDD also allows for trend identification. HDD allows for the tracking of healthcare trends over time, revealing shifts in utilization, costs, and patient outcomes. HDD is appropriate for performance measurement. The nature of the data allows for comparison against benchmarks and identification of areas for improvement. HDD has potential to track patients over time. In limited circumstances where states have access to consistent patient identifiers or identity resolution tools, HDD can facilitate the tracking of patients' hospital experiences over time. There is a potential for data linkage. It is also worth noting that in some cases HDD can be linked to other data sources, such as vital records, cancer registries, and all payer claims databases, to enhance research capabilities and provide a more holistic view of patient care. These data can inform policy. Policymakers and researchers can also gain valuable insights into healthcare spending patterns, cost variations across different hospitals and regions, and the financial impact of specific diseases or procedures. Let's review some important applications of hospital discharge data. First, epidemiological surveillance. Because HDD can provide population-level insights, it plays a crucial role in epidemiological surveillance. It can be used to help track infectious disease and outbreaks, monitor trends in hospitalizations, identify public health threats, and assess the burden of chronic conditions. This can help inform and evaluate needed public health interventions. The second application is quality and performance reporting. The performance measurement capability of HDD is instrumental in evaluating hospital case mix, quality, patient safety, and adherence to best practices. This includes measures like hospitalization rates for specific conditions, readmission rates, hospital-acquired infections, and mortality rates. These metrics can be used to benchmark or assess hospital quality, measure trends over time, and inform public reporting initiatives and efforts to reduce avoidable hospitalizations or improve care coordination. A third application is policy and resource planning. Trend identification capacity of HDD can allow state agencies and healthcare providers to allocate resources effectively and plan for future healthcare needs. Hospitals can use the data to analyze their own performance and identify areas for improvement. The data can also allow them to benchmark their performance against other hospitals and track progress over time. Lastly, these data are applied in health disparities research. Since the data cover full populations and can be linked to other sources, researchers analyze the data to identify inequities in healthcare access and outcomes among different populations. Hospital discharge data are used in innovative ways to address healthcare challenges. Annual hospital utilization reports provide critical data on hospital admissions, readmissions, emergency department visits, surgical procedures, patient demographics to guide public health strategies. Community health assessments get used by health agencies to evaluate hospitalization patterns emergency department visits, and disparities in healthcare access. This data helps identify high-need areas, track preventable hospitalizations, and inform targeted interventions such as expanded primary care access, chronic disease management programs, and public health initiatives. Comparing healthcare facilities. Many states have developed public reporting tools that allow consumers to compare hospitals and facilities based on quality metrics, patient satisfaction scores, and other relevant information and make informed healthcare decisions. Interactive data query tools. In addition to empowering consumers to make informed decisions, the query tools allow users to generate custom reports, visualizations, and de-identified, aggregate data extracts to support research and policy development. Several states have developed helpful tools using HDD to help monitor public health outcomes. These portals can be used to identify communities at risk and inform public health interventions. Here are some examples that highlight how data can be made accessible and actionable for various stakeholders. New Mexico's indicator-based information system includes reports by health topic, like maternal and child health, community reports summarizing baseline conditions and trends in a community, reports for specific public health topics, like inpatient hospitalizations for asthma, and allows users to query hospital discharge data. The New Jersey State Health Assessment Data Query System is a tool that uses a similar architecture to New Mexico's system. Both tools provide access to a wide range of health data beyond hospital discharge data, including vital statistics, cancer registry, and public health survey data, like BRFSS and PRAMS. The Illinois Hospital Report Card provides consumers access to information about the quality of healthcare provided in Illinois, including quality and safety data, nurse staffing, patient satisfaction, and costs of services in hospitals and surgery centers. Additionally, many states have created supplemental environmental public health tracking portals that integrate HDD with environmental data to create public health tracking portals that monitor the impact of environmental factors on health outcomes. This data integration allows for a more comprehensive understanding of community health needs and facilitates proactive responses to environmental health threats. These tools demonstrate the power of HDD to inform public health initiatives, empower consumers, and support data-driven decision-making. Various organizations utilize hospital discharge data to guide decisions and improve public health outcomes. Let's review some of the more common users and their applications. State health agencies monitor health trends, develop prevention programs, and conduct needs assessments to inform policy decisions. Public health researchers use HDD to study disease burden, assess the effectiveness of interventions, and analyze healthcare disparities. Payers and policymakers use HDD to assess healthcare spending, shape reimbursement models, and guide policy reforms that impact patient care. Academic institutions, like universities and research centers, use HDD to study healthcare utilization, patient outcomes, and the social determinants of health. While HDD is a valuable resource, it has several limitations that must be considered when analyzing and interpreting the data. These limitations vary depending on the type of analysis. First, let's consider limitations related to the data's content. The data contain limited clinical details. HDD does not contain related clinical details, such as lab results, physician notes, or medications. This limits its value for certain types of analyses that require detailed clinical information. The data will have gaps in outpatient care. While all hospital-based encounters are generally included, HDD does not capture outpatient visits, such as visits with primary care, specialist, retail or urgent care, rehabilitation and physical therapy, and pharmacy providers. Tracking patient journeys has its limits. Sometimes hospital systems include unique patient identifiers in their submission files that allow researchers to see multiple interactions with the hospital system, but it would only apply to certain settings, like inpatient, ambulatory surgery, or emergency room care. That means that while you can look at readmissions or repeat care, any attempt to recreate a timeline of care for an individual patient based on HDD will be incomplete. Next, we'll discuss limitations related to data quality and the practicalities of data handling. There are always processing lags. As with all administrative data, there is a delay between when care is received and when the data are available in the final database. This lag is unavoidable because of the need for multiple stages of processing and validation. The lag can range from weeks to months, depending on the data collection and processing procedures. data quality can vary across suppliers. The quality of HDD can vary depending on the supplying hospital's data collection and reporting practices, staff resources, and technical capacity. For example, there can be variability in completeness or reliability of self-reported demographic data. As mentioned earlier, some hospitals may be allowed to submit data in a less granular format or with less frequent reporting, which can also create some variability. Payer identification can be tricky. Analyses that focus on insurance coverage or access would benefit from knowing the type or identity of the person or party responsible for paying the bill. This could be a health plan or an individual. The health plan or individual payer name is often reported as text strings, and deciphering them can be challenging, especially since hospitals can use different spellings or abbreviations. Payments are not included. As discussed in Module 3, state hospital data programs only collect billed charges, not actual payments. This can complicate accurate cost analyses and economic evaluations, as billed charges often differ significantly from the actual reimbursement received by hospitals. Researchers must be cautious when drawing conclusions about healthcare costs based solely on billed charges. Despite these limitations, HDD remains a powerful tool for healthcare research and analysis. By understanding its limitations, researchers can plan their analytic designs accordingly and draw appropriate and meaningful conclusions from the data. Access to hospital discharge data varies depending on its intended use. Hospital discharge data is made available to the public in several ways. Public use datasets or public use files are de-identified state and national inpatient, emergency department, and ambulatory surgery datasets available to the public with minimal restrictions on their use. They are commonly used for public health reporting and policy analysis. However, there are prohibitions on attempting to re-identify persons in these datasets. Public reporting tools, like those in Illinois, New Jersey, and New Mexico that were mentioned earlier, provide accessible data for users to explore hospital metrics and trends. Many hospital data programs allow researchers to apply for access to more detailed data. Accessible data typically includes only the minimal necessary identifiable information, such as full dates or more granular geographic details, as determined by an institutional review board. Accessing identifiable data from an HDD typically involves navigating a formal process that varies by state. Let's consider a typical research data request process. Potential research data users generally need to do the following. Define the research question or purpose to clearly articulate the specific research question or purpose for which the data is needed. Submit a formal data request to the state agency responsible for managing the data. This request typically includes a detailed research proposal, data use plan, and information about the intended audience for the research findings. Complete any required data security training to ensure compliance with privacy regulations and data use policies. Obtain IRB approval if the research involves human subjects to ensure ethical research practices. Execute a data use agreement that outlines the terms and conditions for data access and use. And finally, pay any relevant fees states charge for data access, particularly for commercial use or large datasets. This represents the process for the most restricted access cases. The process to gain access to public use or limited datasets may be simpler and only include some of these steps. It's essential to contact the relevant state agency for guidance. In conclusion, hospital discharge data is a valuable resource for understanding and improving healthcare systems. By understanding its limitations and benefits, researchers, policymakers, and other stakeholders can leverage this data to inform public health initiatives, evaluate hospital performance, and drive improvements in patient care. As technology advances and data access improves, the potential for HDD to transform healthcare will only grow. We hope you have found this presentation on Hospital Data 101 helpful. NAHDO and our members are committed to supporting hospital data programs in their various forms across the country. We look forward to your participation in our various supporting programs.
This concludes today's training. I hope you've enjoyed Hospital Data 101. Please look forward to more training from NAHDO through our Hospital Data Initiative. Thank you.